Hello, everyone. My name is Jonathan Shepard. I'm here to talk to you a little bit. I'm a board certified child, adolescent, and adult psychiatrist. Many of you all have seen my work, and I've been asked a lot of questions about what's going on in our society regarding the suicides. Most prominently, the two suicides that occurred last week of Kate Spade and Anthony Bourdain. And I just wanted to address a couple issues, honestly, regarding suicide. Suicide is something that is occurring in our society, in our country, at a rate that is very alarming. If you've been listening to the news, reading the newspapers, even following the CDC, which records the number of suicides that occur in our society or in our country, that the number of suicides are on the rise. And you should be aware that amongst black teens, that the rate is very much increased to the point to where we're seeing suicides almost at a 2-to-1 ratio in regards to black and white teens. So what am I saying? That we're seeing the increase where blacks are committing suicide at a 2-to-1 ratio as compared to their white counterparts. If that's not alarming to you, that's definitely alarming to me. So what I wanted to do, I want to just talk about what are some of the things that lead to suicide. And one of the major things is depression. We hear a lot about depression. I'm often asked if I feel depressed, does that mean that I have depression? And the answer to that question is no. Feeling depressed and having the disorder or the disease depression is two totally different entities. We will feel depressed. That's part of human emotion. That's part of what we will encounter as being alive. There are going to be some days where you just don't feel like dealing with people. You're going to be more irritable. There will be things that will encounter or that you will face in your life, I should say. A loss of a loved one, loss of a job. You just don't feel good. You might be sick, and you just might not be having a good day. But when you have several consecutive days, when you're having days where you don't feel like getting out of bed, and where it's lasting for at least 2 weeks, then that's when we have what's called the disorder or the disease, major depressive disorder. So there is a difference when feeling depressed versus having the disorder, major depression. So major depression, let's talk about it. What does that look like? There is an acronym that's called SIGECAPS, or SIGECAPS. That's SIGECAPS. And so real quickly, what does that mean? The first S means that there's a change in a person's sleep pattern. That means that they may be sleeping too much or not sleeping enough. You may know someone like that, where they cannot sleep at all. They can't get any rest, which makes them then more irritable. And again, this is lasting for at least 2 weeks or longer. The I stands for loss of interest. Things that you used to like to do, things that you know someone used to like to do, that gives them pleasure. And they lost interest, or they have lost the will to even do those things. So that's S, sleep. I, interest. G is guilt. Feeling excessively guilty or excessive guilt about certain things that may not even be their fault. The loss of a loved one. They might feel like they caused the death of that person, or feel like something happened because of them when we know it's not their fault. So that's excessive guilt. E stands for change in energy. That means a person no longer has the ability to even get out of bed, or even energy to even go or leave the house, or even feel motivated to do any work. So let's review. S, sleep. I, interest. G, guilt. E, energy. So C now stands for concentration. When a person is depressed and not feeling depressed but has a disorder depression, there's a loss in concentration. That means a person cannot focus. They're sitting in a classroom, they're at home, they may be sitting at their job. They're unable to focus, unable to concentrate. And this is really tricky because some of our children get diagnosed as ADHD when honestly they may be depressed. because they're not able to focus in the classroom. And so many times we will miss that the child is actually experiencing depression as opposed to just being called ADHD or just being called a child who's not listening. So these are things that you have to be aware of. Then let's move on. The next letter is A. So A stands for appetite. So there's a change in a person's appetite when they have major depressive disorder. Now with appetite, you could either eat too much or not eat enough. A person may eat too much, comfort eating. We hear a lot about that when a person is experiencing depression. They eat large portions of maybe ice cream or other large portions of desserts and just eating so much at one particular time. Just eating just to be eating, not even hungry. Comfort eating, as we call it. Or they may not be eating enough. They don't have an appetite. They'll go the whole day or even days without eating. That is a true sign of major depressive disorder. Then the next letter is P. And this P is a long word called Psychomotor Agitation or Retardation. Now, yes, that is a technical term, and so I'm going to break it down to you. Essentially, what that means is that a person who gets irritable for no reason, just saying hello, and they're like, well, why you say hello to me? That's called psychomotor agitation, or just little things that just agitate them for no reason. You might even be sitting next to them and you ask to borrow a pencil, and you start going, the person starts going off on you, or why you ask me for a pencil? Shouldn't you have brought the pencil? And you just like, I just asked for a pencil. That's psychomotor agitation. Or psychomotor retardation, where this person is going through life like in slow motion. They do everything real slow. So that really ties into that loss of energy that I talked about earlier. They walk slow. It almost hurts to move. These are the people who are experiencing major depressive disorder. Then the last S stands for suicidality. Any person who is experiencing thoughts of wanting to hurt themselves and thinking of plans and ways of how to do it, that is major depressive disorder. True, you may have some thoughts on some days where I really don't want to be here, or maybe I'm better off being dead. But I'm not talking about necessarily that in this case. I'm talking about persons who are seriously thinking about ending their life because they have no reason to live, or they think that things are not going to get better. One of the things that has also been talked about is how suicide is quote unquote a selfish act. And I don't want to debate that, but I want people to know that when people are considering suicide, they're not thinking about themselves honestly. They're really thinking about their troubles. And really, when I've experienced and interviewed and assessed these folks, they are saying, I just don't want to be a burden to people. I don't want to cause anybody any more pain. That doesn't sound like selfishness to me. So we have to be careful of labeling suicide as being selfish, because many times those persons are in such pain that they feel like they're a burden to somebody else. So those are some of the characteristics that you should be looking out for. Again, we're talking about symptoms that will lead to suicide. So we're looking at persons like Kate Spade, Anthony Bourdain. Were they experiencing these signs and symptoms? I believe that they were. Now, I was not their doctor. I did not assess them. I did not evaluate them. But probably they were experiencing some of these signs and symptoms. So what am I telling you? Be on the lookout. Communicate. That is such an important point. You know, there's a saying here that if you see something, say something. And many times I think we do see some things, but we never say it because we just kind of blow it off, or we just kind of brush it aside. But you never know, just by asking a person, are you okay? Are you thinking about hurting yourself? That is a misnomer, that if you ask somebody if they're thinking about hurting themselves, that you're putting that thought in their head. That's a lie. Because actually what happens is you're allowing that person to open up and say, wow, this person really sees me for who I am. And hopefully it will start a healthy conversation. These are just some of the things that I wanted to address. I know that I have some upcoming seminars and discussions, I want you to go to my website, go to my Facebook page, and look at some of the upcoming events that are going to be coming towards you. But continue to reach out, ask me questions. I'm here to help you. I'm here to serve you. And I want to see the best life for you to live. Thank you.